My name is Bill Babjak. I actually grew up on the west side of Gary. I came to Crown Point in 1973 as a member of the Crown Point Police Department. I did that until 2005 and I retired. I've been married 52 years and I have 2 grown children and 4 grandsons. My grandkids mean the world to us. We're a very close, active family. Yeah, I was a high school athlete and I always had physical activity involved in my life. Right after high school, I went in the Army and I stayed there for 3 years, and it was all about good health even back then. And I thought I was doing everything right. Times when I got a little heavy and I tried to control that, but I never left the physical activity. My wife and I made the decision to have this scan. And we talked about it's $49. Insurance doesn't pay for it, but that's not really an excuse to not have it. But for $49, I think it was affordable. So we both went and had the heart scan done. I expected the results to be good for my age, and I was really shocked when I got the results I did. I had the scan done and I was at my consultation after the scan, not knowing what the results were. And I remember her we were just talking casually, and she said, "The fax machine's going off." She said, "It's probably your results. I'm gonna go get them." So she went just to the other side of the room, and when she turned around, she had a look on her face that I thought, oh, okay, I got a problem. She said, "Well, I think you're probably gonna have to see a cardiologist and we're gonna talk more." Well, from there, I had a consultation with Franciscan Health Cardiologist, and it was decided that I would have an angiogram. So I had the angiogram, and halfway through, he said, "You're gonna have to have open heart surgery. We can't finish this." So I totally believed at the time that I was gonna be stented. So then from that point on, a couple days later, I had an appointment with a heart surgeon. And at that point, my son, my wife, and I were in for the consultation. And he said at that point, he said, "You're in heart failure." He said, "Your heart probably has about 6 months." I think I totally went blank. And it's good my son and my wife were there because they heard things that I didn't hear. So I just said, well, I put my mindset was that I'm going to have it done, and whatever happens, happens. The surgical team was outstanding, and then more than anything, the post-op team in ICU. I thought I was well taken care of. Weeks after the surgery, I had some home health care right away, and then weeks after I started going to cardiac rehab, and the people there were fantastic. I mean, I couldn't believe how your heart monitored the whole time, and they're progressing you, just doing all the exercises and everything. I did that for about 4 months, and now I continue on my own. I had my heart surgery 1.5 years ago, and at that time I would not have believed it, and no, I would have thought I was the last person that would need heart surgery. The doctor said, "You would have been the guy out shoveling your driveway, and you'd have just went out." I decided it was a good thing to share my story because I thought people would get something out of it. People in Crown Point that know me know that I'm talking the truth. We've had dozens of friends and family that have gotten a heart scan since I have. It was really a good feeling that had happened. When I come to the hospital and I see that chart in the hallway about the screenings with the $49 and everything, it's just, I would have never had that done if I did not know about a $49 screen. It's just the whole purpose of me being here, being able to be here, is because I got screened. If one person would watch this and it saves their life, that would mean the world to me, because it's just the right thing to do.